This is Good Morning San Diego.
If you're looking to get healthy in 2024, it's about more than just eating well and working out. There's all sorts of aspects to this conversation. So we're going to be joined by Prevention Cardiologist, Dr. Sanjay Bhojraj.
Good morning, and
Dr. Sanjay,
thank you for having me, Paul.
All right, so we're going to talk about Well 12 in a second, but you know, I remember when my grandparents were elderly, and the cabinet would be filled with prescription drugs, but they were sedentary. And I was just thinking that we want to get away from having 31 prescriptions, right?
That's exactly right. And I think too often we rely on medicines for our health, but there's so much that can be done with diet and lifestyle alone. And my goal in 2024 and beyond is to really empower people to take over their own health. Get away from these buckets and buckets of medicines and live your life. Learn how to sleep, learn how to eat, and let your health follow from there.
I think this is going to ring true with people who just don't like going to the doctor and would like to find a way to circumvent.
Listen, I hate going to the doctor myself, and I call myself the cardiologist for people who don't want to go to doctors, because I've had patients over the years who at 90 years old, that was the first time they ever saw a doctor. Maybe they gave childbirth when they were 20 and then saw a doctor in their 90s. And what happened in those 70 years? Well, they took care of themselves. They learned how to exercise. They learned how to eat. They had discipline. They went to church on Sundays, all sorts of things that really helped their health.
So tell me about Well 12 then.
So Well 12 is my online program that really gives people the structure to learn how to take over their health. We focus on 3 pillars, which is diet, sleep, and stress. And if you can just optimize those 3, health will naturally follow.
So, in talking about your segment, I brought up that Tibetan proverb.
Yeah.
Eat half, walk double, and laugh.
And smile triple.
I mean, that's the pillars right there, right?
Well, that is, if that's all we did, that would be great, right? But I think in modern society, most of us don't have the ability to go up to the mountains in the Himalayas and meditate for hours a day. So we need to make it part of our daily routine. So how can we make wellness tactical, I guess, in a sense?
All right, so bullet pointer for me. Take me through the introductory course.
So the first thing we talk about is the diet. So I think diet is so confusing because nutrition science is very confusing. So what we focus on are foods that reduce inflammation in your body and optimize your cardiometabolic health. Which are things like vegetables, things like getting sugar and processed foods out of your diet, eating foods that you connect with, and foods that are correct for your body, because your genes are different than my genes. And I teach you how we figure that out so that you can eat optimally for you and I can eat optimally for me.
People are going to, you know, when they hear the word vegetables, they just, is there a way to eat food that you enjoy eating that are also good for you?
Well, and that's a lot of what we focus on, is that a lot of the foods that are actually good for you, we can derive joy from. It's just that we have become so accustomed to these ultra-processed foods. I tell people most of the foods that we eat are really engineered for the tongue, but nothing else below in your GI system.
Fascinating. All right, so then we got about a minute left here. Talk me through the exercise and then the stress reducing.
So stress reduction, we focus a lot on the mental resilience and how we respond to stress. But today, you know, if you want something for a Thursday morning here, something simple that you can do is when you're at a stoplight, at a red light, take a deep breath in, hold it for 4 seconds, and then breathe out over the course of 4 seconds. We call that box breathing. So 1, 2, 3, 4 in, hold for 4, breathe out for 4, and hold for 4.
Boy, if we could get everyone to do that, we would cut road rage in half, right?
Road rage would disappear.
Right. All right. So we're obviously we can't do the program justice in a short time we have here. Where do people find you?
So you can find me at www.well12.health and set up a meeting with me online. The entire program is online, so you can be in Maine, Hawaii, San Diego, Los Angeles, Orange County, anywhere. And it is really meant to give people the structure and the tools to succeed on their own.
It was an honor to meet you, sir, on your first visit to KUSI. Please come back.
I would love to. Thanks for having me.